Liposuction is a cosmetic surgical procedure that is used to remove specific areas of fat that have been resistant to diet and exercise. The ideal candidate for liposuction is someone who is at their or near their ideal weight, have areas of fat that they can't get rid of no matter how much they diet or how much they exercise, and they have good skin quality over the area. Too much loose skin, and you might be a surgical candidate as far as a different type of procedure than liposuction. There are many types of liposuction. There's traditional, just suction-assisted liposuction. There's laser-assisted liposuction. There's power-assisted liposuction. And there's ultrasound-assisted liposuction. You can get good results with any of the procedures. In our opinion, some are better than the others. But I think you have to leave that to during your consultation to discuss with your surgeon. Preparing for your liposuction is really quite simple. In our practice, we do them all under a local anesthesia, so you don't have to worry about anesthesia, sedation, and the related testing that may have to go along with that. So really what you do is you avoid your aspirin, you avoid your Motrin, you don't smoke, and also, just follow the instructions that the surgeon has given you as far as showering or other care they may want. The other thing that's important is you have to make sure you have your garments to prepare for afterwards in your home, and sometimes some ice packs would help as well. And of course, like for all surgery, stop smoking at least 2 weeks before the procedure, or if you can, just stop smoking. So during liposuction, the area that we've marked out where the fat is to be removed, we create tiny little, I call them ports. They're tiny little openings in the skin. In our practice, we don't even have to put a stitch in them afterwards. And the instrument that is used, if it's the instrument that takes out the fat, it's called a cannula, but it could be a laser fiber, it could be a power-assisted cannula, are inserted through that area, and the local anesthesia has already been put in, so it's possible at that point to either melt the fat with laser, break up the fat with power-assisted, or just suction it out with the cannula. Recovery after liposuction is probably one of the easiest recoveries of most of the surgeries we do. You will have to wear a garment, and you might have some bruising, but really there is no reason why patients can't return to work and most of their normal activities. We tell the patients, if it hurts when you're doing something, probably you should stop for a while, but overall there's not a lot that you have to do in the recovery period other than wait for the result. Patients often ask, are the results permanent? Period. We've removed the fat. You maintain your weight and you exercise. The look that you were looking for in that area is permanent. People ask about the risks after liposuction, and you do hear about disasters, but if you look at those cases, they generally were not done by a board-certified plastic surgeon. The risks in all surgery, you have risks of bleeding or infection, bruising. It's really rare. I would think that the most common result is that a patient, maybe they had a perception of what their body was going to look like, and even though we got rid of the fat, it doesn't fit the image. But other than that, the risks are very low. Liposuction is not a weight loss procedure. Liposuction is a body contouring procedure. So that's why we say the ideal patients are those that are near or at their ideal weight. Do not seek liposuction if you think it's going to avoid having to go to the gym or following a healthy diet. Liposuction is used as a standalone procedure, but it's often combined with other procedures such as abdominoplasties and thigh lifts, surgery on the breast. So it's a very useful tool to help with the results of other surgical procedures as well.